jabs, I will be stronger.
So that's why even those who have had a bout of COVID infection, we have no problem with you getting the COVID jab, because it will build on your strengths and the immunity becomes even much stronger.
Okay.
Maybe Professor will answer on, because here when you have active disease, I think we ask you to first go through the treatment. You don't get the jab when the disease is actively showing. If you have symptoms like somebody who is in the hospital, we don't immunize that one. You first go through the disease.
Yes. Professor, you want to add on that before I bring in my colleagues here now?
Yeah, I think
I need that issue cleared, because people are so attentive on that.
Yeah. Yeah, for now, the recommendation, we are not testing you before we vaccinate. Yeah. But those who have disease and they are sick, they have symptoms, we say wait. We don't want to add. You have fever, you have this, then you add another, because the vaccine can also give you other side effects, fevers and the rest. Hold on. It is a very good scientific question. What do you add if I've got my natural infection? As the minister said, there is no harm. Yeah, there is no harm in giving you. Yeah, some people get natural infection and they get very good immune responses. Others do not. In the studies that have been done elsewhere, they have shown that even those who got infected and have gotten vaccinated, they have had very good immune response even to the vaccine. Because you can differentiate an immune response to the infection itself and an immune response to. There is a stage, yeah, when if somebody has natural infection, you have your antibodies, you have your T cells. Some scientists may say at that stage, if I give you a vaccine, the body may see it as foreign, yeah, and not react to the vaccine, and you waste it, yeah. Not that it is giving you harm, that it may not work, because the body may see it as foreign. That's why these studies that are being done also are helping us to say that no, some studies have been done and shown that those who have got infected and have been given the vaccine, they have been able to have sustained an immune response. I think what I tell people is that the key thing, there is no harm.
Okay.
It's not going to affect you. The question is, how much immune response will you have when you already have natural infection compared to those who don't have a natural infection? It is an immunological question rather than safety. So there is no safety concern. Yeah?
Immunological.
But it is an immunological, something that we need to carefully look at. Do you get a better response or not? But at least there is no harm in getting a vaccine.
Yeah. Thanks a lot, Professor and Doctor. I need now to come to Abantu Wawansi on this matter. Sarah, you will understand with Ramadan, you will understand why I had to take more time with the professionals in this area. Now, the president was very, he was very energetic when he spoke at the conference at the medical conference at Munyonyo, where he said his biggest blame is the issue of equity in accessing vaccines across the world. And that's what I want us to touch on. Given what we have seen, we have experienced, and we have heard from these doctors, what do you make of this? When the president says, I am happy there is this unfairness because it wakes up Africans. Why must we keep borrowing? Why must we keep begging? Africa is literally at 1 million. The UK, I'm told UK, by yesterday, I think they had done about 44.5 million people vaccinated, given jabs, at least the first one. The US, about 76, or even 170 actually, the US, 170 million people already vaccinated. Uganda, 1 million, we hardly reach 1 million. If we reach, maybe by today, because I saw so many lines. I moved around town, and so many people were going. Many people were moving. And up-country, you saw reports on UBC doing up-country runs across the country. So many people rushing for this. What is this politics about the developed world having enough vaccines, and that the developed world or backward, developing countries, okay, yeah, developing countries. Maybe I said what I want. I was thinking.
Yes, you should have said.
That developing countries are hardly accessing the vaccines. What's your take on that, Sarah?
No, thanks, Charles, and I wish to thank our scientists on the panel for demystifying a lot of myths that, you know, are causing vaccine hesitancy and a lot of, you know, conspiracy theories, especially through social media in our population. On vaccine access and equity, we all watched COVID first on our televisions. The Western world was the most, and is still the most affected. I think we haven't reached their levels of infection.
True, true.
So when you have your
own... I think in Russia, I think yesterday alone, they lost 650 people, just one day.
Yes, we haven't reached their levels. The US, America, India, Italy, what happened under the first and second wave, we haven't reached those levels. So when you have your own house on fire, do you first rush to pour water on your neighbor's house, or you first rescue yourself? I know we had made a booking as a country from Serum Institute in India for bunches of vaccines. Then India caught fire with a very huge population, with a very, you know, congested people in slums, kind of. So they were on fire. So if you are a leader in India, whom do you rescue? You have your house on fire, you have reversed orders, and you are unable to help your neighbor. But we have other countries in the US, other institutes that were manufacturing, you know, vaccines, who had sort of put fire out. And if they were basing on principles of equity and justice and you know, what we call in our concept Ubuntu, maybe they had more flexibility to export vaccines as compared to India, where fire is just coming down, because they are just finishing that deadly wave, and they are worried even on a possible third wave that could be worse. But generally, when you look at what our experts have explained, I think what the world leaders need to advocate for now is opening up the private market in vaccines. Looking at allowing private operators to access these vaccines that have been developed and to do commercial production in other countries. I don't know whether it's possible, and they will advise us, as I warned. Really, we are lay people in this debate. So if it is possible to access these protocols and whatever has been developed and to do commercial production in Africa for massive vaccination, yes, these are the debates that leaders should have in their fora. If you look at the Serum Institute that committed to do a not-for-profit vaccine for world rollout, especially in less developed countries, reports are saying that they are so distressed by the criticism and the extent, you know, yet they thought they were helping at a not-for-profit basis to help curb the pandemic. But my other concern, Charles, would be about the behavior of the European Union. European Union is a big member of the COVAX facility that is helping us with vaccines. But they have gone ahead and blacklisted AstraZeneca under their Euro vaccine passport. Are leaders engaging those double standards? You are rolling out a vaccine to the world, and you are blacklisting it, that the people who have received it are not welcome into the country. Then the debate, because the AstraZeneca thinks there is politicization on the blood clotting theories. So the politics of vaccination, they think that other giants just want to take them out of the vaccine market, because the latest study I've read online from the safety immunogenicity on the COMCOV, the studies they are doing, they are saying that out of the people that got affected by the blood clotting, out of 17 million people, only 37 got affected.
37 or 47? There were 47.
Yes, yeah. And there is no concrete evidence to confirm that they wouldn't have got those blood clots if they had not taken the vaccine.
Yeah. Yeah.
Then you go out on such a small portion of effect, and you are using politics. So they think it's more politics than science. So it's good we have our political leadership here. I think those are the things they need to engage in their groups. What is it? How do you give us a vaccine and blacklist it? Are you saying we can't come to your country? What happens to our bilateral and international relations? So what is it? And then that contributes in creating the vaccine hesitancy globally. Yeah. So I think these are the things we need to interrogate.
Thank you so much. Let me bring in Ramadan, and then after Ramadan, we shall go for a break. There are so many questions that are coming in. There are so many people. This is about human beings. So many questions have come on WhatsApp. I've not yet even checked Twitter, WhatsApp, and inbox. But Ramadan, go for it. You know, the question of the politics especially, merged with this science. For example, what Sarah has raised, how does it affect us? And what must our scientists do, our political leadership, what must they do? And relating it to the conference that has been going on in Munyonyo, and the concern of the president.
Thank you. You know when you were beginning, you talked of backwardness, backward countries.
I recanted.
No, you were right, because Deng Xiaoping, this big leader who transformed China, when he was accepting the leadership in December 1978, you know, you reminded me the words he said, and I'm going to quote them. He said the basic point is we must acknowledge that we are backward, that our way of doing things is inappropriate, and that we must change. And since that time, China has never looked back. They accepted that we need to do what Schumpeter called creative destruction. The ways we are living our lives, they are not going to take us anywhere. And I think this is where Uganda in particular and Africa generally is today. I know that, you know, the president has been saying this now for some time. You know, his inaugural speech, when he was sworn in, he said the same statement to his colleagues who were many at Kololo. He repeated it at Parliament, one of those speeches he gave, and then at Munyonyo. To me, I think going beyond the self-condemnation and or what we are not doing, one truth of the matter is we haven't, as Africa, and I want to use our country because the one I know better than other countries, we haven't been seriously appreciating what science, research, and innovation contribute to society. And it would contribute to our transformation as a population. COVID came, you know, COVID is a wonderful disease. It came to wake up all the humanity, but in particular Africa and Uganda. You know, we were talking of HIV and all those other things, why they haven't got vaccines. I don't think there has ever been a disease in this generation of all of these people who are alive that has devastated the world the way COVID has done. In a very short time, 1 year, to hear that 2 million people have died over, and most of these people are really the greatest, are living in the greatest of societies. You are talking of the great 8 nations, the G8. They have seen more numbers dying, and I think that explains the response, why it was quite unprecedented, quite fast, and the level of efficacy, which we haven't seen before. And it is something which I think now going forward, we need to realize that when we are waiting on others, who are equally, like Sarah has said, they are in the same problem, they will have to first cater for themselves. Because now I see Europe, they are watching football without masks.
Yes, in big numbers.
I'm here talking, mask is really disturbing me. But for them, they are hugging.
President Biden met Putin and very
saw,
close, and they were greeting each other without masks.
In the Oval Office, they were seated there, no masks.
Even the Queen of...
Yeah, so the world has, for them, they have moved on. They are now living in the future of our future. We are still backward. And this brings me to, for me, to the points I came to speak, Charles, not your things. In this thing of the politics of science, I mean COVID vaccine and the science, I came really to quarrel with Ugandans. We are very unserious people, much as we are blaming, you know, the entire Africa. And so we are very unserious in the way that up to now, they are people very well educated. Some are PhDs, others have master's degrees, others are having 1 degree and so on. And they are still believing that they are going to deal with the COVID by using things which are contrary to what scientists have said.
Using witchcraft.
People are busy bashing the frontline people who are fighting this disease, fighting them, and going to the you know, taking herbs or grasses of whatever tribe. There are people who are just praying. They are saying, for me, once I pray, I go to the market. God is protecting me. There are so many I've seen. Others, they are in superstition. You call it superstition.
Superstition.
Some are in rumors. Social media has replaced science. People are sharing things on WhatsApp. All WhatsApp groups are full of rumors and gospel being shared by educated people. And the narrative also of you, mainstream media, has been a narrative. You know, you have set the agenda now, agenda of showing that we are dying because the health care system is poor. It is poor because the money which is supposed to improve it has been stolen, or because the doctors and others, they are selfish, and so on and so forth. And now this has taken a message to the population that we are dying because of the inefficiencies elsewhere. So the blame games and the associated kind of issues. And these blame games also, I see them, even you see in government, leaders are blaming technocrats. Technocrats are blaming themselves. They're blaming doctors. Doctors are blaming their supervisors. Supervisors are blaming others. So to me, I see this as something which we are losing now. From the first wave, we were more coordinated. The media narrative was more pro-COVID response. This narrative is in terms of showing that we are dying because of somebody else's problem. We need to change the narrative. Even on this very vaccine topic we are discussing today, and I wanted to ask the minister who's in charge of communication and guiding the nation, is government really in charge? Why am I asking this question? Everybody now is addressing media, is calling a press conference. And what are they saying? They are saying conflicting information, giving conflicting information to the people. In other words, misinforming the public. The other day I saw in the media that people were vaccinated of water.
Yesterday.
The fake vaccine.
Was it yesterday?
Yes,
fake
last
vaccine
night.
yesterday.
Fake vaccines. People were vaccinated, fake vaccines. And it went around. The whole of today, people have been sharing that, now you see you people who went for vaccine, you got water.
You were injected with water?
Yes.
800 of them.
Absolutely. And now I was wondering, how do you communicate sensitive information like this one in the middle of a war?
Pandemic, yeah.
Even if they were, of course,
What if they were true?
there were loopholes. No, what I'm saying is this, and it is true that there might have been people who counterfeited or who went and got some,
Stole some of them.
they stole a few, then they refilled, maybe with water, and went and asked people to pay money. But as we all know, all of us who received these COVID jabs, we received them free of charge. So when you are communicating that people were they paid 200,000 or 100, and they received the vaccine, you need to underscore it by telling the people of Uganda that vaccines are what?
For free.
They are free.
The genuine ones were free.
So if you are going
And
to
only
go
from
and
government through national medical stores.
absolutely, but people are ending up going to quacks as usual. Somebody asks you, come to my clinic. We hide somewhere because you know vaccines are now very scarce. Give me 100,000 and I give you, and then they inject him water. Now when you spread that as the big narrative now in the country that the people are getting water, when will I know that this is water and this is a genuine vaccine if you have not clarified to me that the vaccine that was supposed to be free, some people went and paid money to receive it. And that is whom should we blame in that way? Should we blame the quacks, the regulators,
Or the government coordination?
the government units, or even the people themselves? And that goes to the communication strategy itself. I think there is a huge gap there. Government is missing in terms of coordinated movement in communicating this, among other things they are supposed to be doing.
Okay, good. Very important information. And Honorable Baramunsi is the one who is chairing that committee, supposed to help coordinate and streamline communication getting out. But the question that someone may ask, does COVID mean government work and decentralized government work must stop? That's something we have to think about. But we need to take a quick break. When we come back, I'm going to read the comments and questions that have come on top of the ones raised by Ramadan and that very important, the Honorable Minister, you will not need to forget it.
But also there is
the
Charles,
council
just
Sarah.
one moment.
Yeah.
There is another aspect related to that of trust. This vaccine politics we are discussing is driven mainly by that concept of trust. trust in the science, trust in the science, what science said, trust in government, and trusting in the health care system that is providing, for example, the service right now to people who are
But can
depressed.
I shock you? Can I shock you, Ramadan?
Yes.
I try to read a lot for my work, vastly and broadly. Do you know that there are 3 industries that you must fear in the world? One, without putting them in order, one is the arms industry, ammunitions, people who distribute guns for people to kill themselves. The second one is the oil industry, energy. The third one is pharmaceutical. But can I shock you that pharmaceutical, these things of drugs, vaccines, is #1 in terms of, if you, let me use the word that people in Uganda use, mafioso. Do you know that the pharmaceutical industry? So I want to bring that for us to think about, and for the person out there to think about, read about the kind of scandals in the pharmaceutical world that then add to what you are saying, that the politics of vaccine is not just a Ugandan thing. And let's leave it at that, but let's go for the break, and when we come back, the discussion continues, and I will take your questions. Please bring them on, keep sending them. Professor Pontiano Kalebo, Dr. Barrio Munsi, Council Sarah Birete, and Ramadan Gobi will respond to each of them as you send them. Let's go for that break now.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Century Points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
COVID-19 chija kugwa. If we get vaccinated now, observe social distancing, wear a mask properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
What does it mean to be closer together? It's taking the last bus home for a surprise visit. Closer together is strangers finding a connection. It's bringing home something much more than a box. It's the warmth of home, or the beginning of something new. There's magic in sharing the things that we learn, because it's those things that bring us close together.
Man, guess what happened yesterday? I entered the what? The taxi. But the pregnancy is from the what? The generator. Then my phone does toto. And the toothbrush breaks in the what? In the porridge. Then I call who?
Wait, what?
First wait, I am still telling you. Then the jerrycan does what?
Love to talk? MTN My Paka Paka now has more minutes. Get My Paka Paka voice bundles to talk and talk at no extra charge. Dial *160*1# to activate My Paka Paka.
Everywhere you go, MTN. Fellow Ugandans, you know that the current COVID-19 period is a trying time in our lives. However, we still have another threat that has been with us for a long time, and it is called neglected tropical diseases, also known as NTDs. NTDs include bilharzia and worms that cause swollen stomachs. Trachoma causes blindness, and elephantiasis causes the swelling of legs. These diseases are affecting millions globally, and yet they can be prevented by regular hand washing with soap and clean running water, regular washing of the face with a soap and clean running water, keeping dirty hands away from your eyes, always using pit latrines and discouraging open defecation in your community to avoid flies that carry germs, reporting to the health facility early when feeling unwell. Remember to stay safe and protect yourself. This message is from the Ministry of Health with support from a SAIN project.
Welcome back from the break. This is Behind the Headlines, and today, Wednesday, the 30th of June, 2021, we are crossing into the second half of 2021. Like someone would joke that we might not add this year on our ages because we are not using it a lot. So we shall have to deduct. Last year we didn't use it. So Ramadan, if you were 35, minus 35, you are only 34. You did not use last year. It was not utilized. So this year also we shall deduct. And God should ensure that we shall a year not utilized is a year that we shall not add to our ages. Let me start. The messages are many. The questions are many. Billy, I won't start with yours. Let me start with someone called Ruhanganyine. Ruhanganyine says, Charles, kindly ask Professor Kalevu to explain why eligible persons are required to sign consent forms before getting AstraZeneca vaccine jabs. To Honorable Dr. Chris Baryomunsi, as at 27th of June, 854,443 had received one AstraZeneca vaccine jab. This is in spite of the surging COVID-19 cases. What's government's short-term plan of stepping up vaccination drive with special focus on rural and hard-to-reach communities? Thank you very much. You have asked a question that I had planned that I would ask towards the end, but thank you so much for that. Stephen Otage says, Charles, please ask the doctor why, one, as scientists or researchers, they did not publicly approve Professor Peter Ogwang's artemisinin-based malaria drug he developed before, and now Covidex is approved by NDA. Two, why does it look like our scientists are scattered in their research? Professor, that's for you because you are one of the researchers and the scientists on the task force. They do not have a common voice answering public concerns on whatever they are doing. That's from Stephen. Then another person, Kamugisha Invest, says, hi, Charles, good work by the panelists, but ask for me, Honorable Baryomunsi, to explain why people sign, this is another one, signing consent. Why people sign agreements before vaccination, yet he says all vaccines went through all the stages of trials. Otherwise, good work. Thank you. And then Patrick is asking, hello, can one use different vaccines, cross vaccines, when taking the two jabs, that is AstraZeneca for the first jab, and Johnson for the second jab. That's from Patrick. Another person here, Bernard Chankara. Bernard, your question is very long, but let me try to... this is science. I don't want to adulterate the message, but kindly send a short message so that we can have as many as possible. He says, Charles, thanks for the show. Very lively today. Thanks. And he says, I just did a video with the efficacy methodology underpinning the need for Africa taking control of its processes with regards to producing vaccines. The politics of vaccines still looms large on us, and I think we must be deliberate on our efforts. I agree with Sarah. If those COVID protocols can be shared, then it's good. But if not, then African leaders need to quickly develop a coordinated effort to manufacture vaccines so that it is sustainable. COVID will take some time here in Africa if we don't act now. We must have some control over research. Bernard, thanks, though too long. And then someone here, Alex. Alex, yes, it is. Alex is saying, is this UBC? Is this behind the headlines? Alex, yes, it is. And then... What is surprising him? Alex, what is surprising you? We are doing a show, and the Honorable Minister has supported us to do a good show. He's the minister in charge of the sector. So why are you complaining? I hope that wonder was a compliment. I hope we didn't use too much science. Jamil Muhanji is sending a message all the way from Sierra Leone. Jamil Muhanji says, he's a Ugandan working in Sierra Leone. He says, he says he's perturbed by the costs. That what is this 120 million we hear about that people are paying for treating COVID? What specialty are they treating? What are they charging for? We used to hear about such charges in Europe, in Germany, for air tickets. What is this? Can't government intervene? Honorable Minister, you need to answer that question. Is government, then he says, nice question from Ramadan. Is government in control of media in the pandemic? Then he says, as media, I saw a heading, Doctor heading pandemic all the time was addressing an audience. I don't know, the writing, he wrote it very fast. But is media not misinforming the audience? Media has played a role of disguising. It's like social media is guiding government. That's from Sierra Leone, but a Ugandan. Then another person called, this one is a doctor, and he doesn't want to be named, but he's a medical doctor. And he says, Honorable Charles has a lot of work to do because many of the people peddling conspiracies are the educated who think they are intellectuals, but they are educated idiots. Sorry to use that word, but he has written it, and I think it is a word that has been used before. Ramadan, why are you laughing? You have heard this word used before. And you are the one who started blaming the educated. And then now, see, he says, I agree with Ramadan. I think he must have heard you use this word. I agree with Ramadan that communication is where the government has been tangibly absent. Thanks, doctor. Another person called Oriema Robinson says, good evening, Charles. Kindly accept, no, this is not for COVID. Then another person called Santos. Santos says, how does Honorable Chris Baramusi assess the strategy of Kenya of being in control of buying vaccine instead of being at the mercy of the donors, a vaccine is supposed to induce the body to produce antibodies that protect an infected person who has recovered already has antibodies. Why are some people advising recovered persons to still go for the vaccine? Santos from Terego. I think that has been answered, but the doctors can, I don't want to make any mistake, the doctors can add to their explanation. Mivule Ronald says, hello Charles, my question goes to Professor Kalevu. What is the efficacy of the available vaccines? And he says in bracket, AstraZeneca, Pfizer, Moderna, and so on the new COVID variants, e.g. Gamma and Delta Plus. And then he says, remember that these variants showed up later after the production of these vaccines. That's an important question. Can the already made vaccines protect against the new variants? And then Louis, I usually call him Louis Wodacholi. He has sent a message. He says, kindly ask Professor Kalevu, is there some correlation between one's blood group and body resilience to the virus? Louis, if you think your blood group or that you are immune, please go for the vaccine. That's from a lay person like me, but Professor will answer. Suggestion to Dr. Chris. Following the approval of Covidex by NDA, government should buy for each vulnerable household some doses. A combination of feeding and treatment may be a better strategy with support. With support being extended to the vulnerable people. And then I'm going to skip some of the messages that are too long because I need to pick your messages, your questions as much as possible, but you have written very long messages. Someone here called Batamba, he says, Charles, you're right. Pharmaceutical industries have power and they have centers of power. Others are organized. Those others are organized religion, the media, politics. Those that agree with them knowingly or unknowingly will survive. If you stand in their way, they will use the other centers of power to do away with you. And if the other centers stand in pharmaceutical way, the cartels will hold you hostage until you fall in line. James Emiriat says, Charles, thanks for this show and always being in control. Thank you, James, for appreciating. He says, kindly ask Dr. Chris Baryomunsi, what regulatory mechanisms are in place by government for private companies that are vaccinating their staff without issuing vaccination cards? Let me add to this, Doctor. Ramadan referred to the issue of the report that 800 fake vaccines came out.
But also there were vaccines that were stolen.
What I have got from some of the investigations going on, and I will not mention because not to jeopardize, but some of the investigations being done are that there were companies, majority of this were companies that brought people to vaccinate in their compounds at their office premises. So how did that happen? You see, majority of the people who have been vaccinated with the so-called fake, and I'm told on the bottles, the bottles for the vaccines, the top part, the rubber part where you inject, there are multiple injections on them, meaning that they could have been recycled, used, you see. So this person is asking an important question about companies. And then Someone called Alex Tibb says, is COVID-19 being promoted anywhere as a cure drug or an immune-boosting drug? Alex is asking. And then there are comments that came, oh man, there are too many online. Charles, welcome back. Thank you. Is called Nixon. Ask Professor Kalebu, if vaccine is tested on animals, it may not kill an animal, but it may kill a human being. Is that not so? For example, he says, we usually use Indoseed capsule for treating human beings, but we use it to kill rats. You explain. Gobi, your question, Ugandans behave like their brothers in Judea who could not believe that Jesus can be born in Bethlehem. Ugandans can't believe that vaccine can be made and customized in Uganda. That's Nixon. Then someone, this one is from Apache, says, good evening, a lady or a man. Good evening, Mr. Charles. I'm Eric, now a man. I'm Eric from Apache, and now the lockdown has tied me here in Kampala. I can't go back. Yet I am running out of ARVs. How best can I be helped? Thank you. Honorable Minister, you need to respond to this. And then I am going to read now about 3-4 messages, and there are many, many of them. Thanks so much. Mr. Gobi, how many COVID beds are in Butambala? This person is called Geoffrey. Government has not done enough for the rural Ugandan, Gobi. How many beds of COVID? Are there special COVID beds?
ICU, maybe.
He wants ICU.
But not everybody who is admitted goes to ICU. Those are some of the myths that should be also done away with.
That's the media. That's what you have seen.
You know? And then someone called Aflod says, Charles, thank you so much. Can Mr. Gobi tell us whether he has ever read the book called Power, Politics, and Population Control? Secondly, who and why was COVID created? Does it know that? No, I don't think I have to go into this. This is the too many myths. COVID was created, AIDS in a laboratory. These are things that
typical.
I fear to engage in too.
It's not happy with me.
Then I think finally, okay. There is someone here saying, Charles, let Dr. Chris apply the formula, effective communication, coordination, cooperation, consultation, and common sense among government structures, including other relevant stakeholders, should be applied in dealing with COVID. I am from Kasese. I think those are the many questions that I can take, and I think the rest now, those who are sending more messages, at least I've read your message, so you don't need to repeat. We can keep the rest for another time. And there is one, Charles, please host the COVID-19 guy. Okay, we will try to get Professor if he can accept. Then this one says, I'm here watching you live from Sierra Leone. Thank you so much for that. And let's start. There are so many. And I've not yet read the ones on Twitter. I will get them from my technical team, and then we include them in some of the messages which I'll read towards the end. So let me ask Professor to start us on responding on some of the questions that have come. And You can pick the ones you respond to. Dr. Baramusi can just escape them and just respond.
They are all
to
their
others.
questions.
There are many.
There are many.
And this tells you how interested people are in this matter.
There are
which
many.
is a good thing.
There was one of consent, which was addressed to me and the Honourable Minister. I'll leave the Honourable Minister to deal with that, with the consent, where we are requesting people to get consent. Scattered. It's a very good question. We scientists doing research, we are scattered and we have no common voice. I think I agree on one hand, but there are also efforts being made. Indeed, if you compare us with more developed countries, in Africa, we're a little bit more scattered. In Uganda, there has been efforts to bring us together under institutions. Agriculture, NARO, I think NARO has done quite a good job running many institutions that have done quite good work. In health, Uganda National Health Research Organization was created. There's an act, but the funding has been quite limited. Ministry of Science, Technology and Innovation is helping bring people together. There are other research institutions, industrial research institutions, and in universities. But I think we need to do more and do better so that we can have a common voice. Related to that, the common voice is research funding. Unfortunately, research funding in Africa is very limited. The country that puts in the highest amount of money into research is South Africa. But many of our African governments, they have not reached the declarations they made in funding research. A lot of the research we do, for instance, at Uganda Research Institute, it's money got from international funders. We write proposals, we get funding. Government funding is increasing, but it's still limited. If we have more funding, more organized, I think through these organizations that they have set up, UNRO, NARO, Ministry of Science and Technology, it would increase and boost on our common voice. I think we are moving in the right direction, the efforts, but I think we need to do more, and this is a challenge in many of our institutions. So there's a question about, I think, let me just quickly go through those, I need. There was a question about vaccines and variants. Indeed, it is an issue that, that's why even they were called variants of concern, because of some of these effects. For most of these variants, some of them, what has been found in the lab, let's differentiate in the lab and those who are getting vaccinated. In the lab, some of them have shown the variants reduced responses to antibodies when you are in the lab. Some of them, like the South African variant called the beta now variant, the vaccine AstraZeneca was not very effective for mild disease and moderate disease. But the good thing generally to summarize is that although we have seen some reduction in protection, some of these variants or infection, they are effective against severe disease, which is very important.
They are effective against
they are effective, they work against severe disease. The AstraZeneca, the Moderna, the Pfizer, they are still effective against severe disease for these variants. You can see some breakthrough infections. Israel recently reported breakthrough infections after Pfizer. Infections can go, but at least against severe disease, we are still okay unless something new comes up. And then blood group, there's no evidence. There were some reports that blood group O can protect you, but I think generally the science we have is that blood group, you are not safe whether you're blood group O, so that doesn't.
I would testify. My mom is blood group O, my dad is blood group O, I am O+, but I suffered COVID.
Yes, so let's throw that away. Animals indeed are not humans, and that's the challenge we have in research. Animals, we use animals, but not humans. That's why they start normally on small animals, the rats, then they move to something that's near to you, the chimpanzee. Many of these vaccines and drugs, they move from small animals to large animals like chimpanzee. But generally, it's not the same. And when you go into humans, that's why they start small. Phase 1, 20 people, 30 people, cautiously. But what can you do? We cannot start these studies straight into humans. We need to start slowly. But that's a challenge. They're not the same, but you do as much as you can, starting from small animals, large animals, then a few human beings. And the dose you give also depends on the size of the animal that you are giving. Antibodies, people have recovered, they have antibodies. Why are you vaccinating them? It's an important scientific question. That's why I say the arguments now that are going on are more immunological than safety. Yeah. If somebody has antibodies, the challenge is if somebody got vaccinated, yourself there, sorry, got infected yourself, do we know that you have antibodies? You develop an immune response? Some people don't develop these immune responses. Others do. But more work needs to be done.
How do we test that we have developed them?
Antibodies. Very easy. You just use either ELISAs or rapid tests. All you need to do, if you're naturally infected, yeah, because the vaccine is only against a small part of the virus, yeah, so you can have tests that will look at that and tests that will look at the other parts of the virus. Like you who was infected, I expect you to have antibodies to other parts of the virus, the envelope, nucleoprotein. The person who is vaccinated will only have antibodies to the spike region. So you can find a way of differentiating these infections. But it's an important question. If I have antibodies, but the question is there are lots of unknowns and more is being studied. How many people develop natural immunity and for how long? Maybe you're better to boost with a vaccine.
Yeah. But Professor, on that I think, I was speaking to another doctor, younger than you, of course, less experienced, but a good doctor. And he told me one thing that maybe you and people like Dr. Baryomunsi in public health education should be telling people. One, that the vaccine is not a treatment in itself. It is like a defense that it will help to reduce or lessen the gravity of the attack. Yes. So if it would have killed you easily, it will give you symptoms, something like that. And then two, that we need to tell people that COVID is a new disease and a lot of information is still being learned, even as we are still learning.
Yes, exactly.
Yeah, I think we need to tell people that, so that people do not pile every pressure on you as if you were meant to scale.
For instance, this question of antibody, when somebody has antibody, it's a good scientific question. I'll give you an example. In measles, I've been telling people in measles, for a long time we have said, let's not vaccinate children who are less than 9 months. Partly the reason, they still have antibodies from their mothers. A measles vaccine is an attenuated virus. If you give it to the children, the antibodies will be there, and they will quickly fight the vaccine. And it may not be useful at that stage. Wait until after 9 months, when the antibodies are low from the mother, then you can vaccinate with the measles, it will work better. Yeah. So those are scientific. Even in the COVID, we are saying, as you have said rightly, a lot is being studied at the same time. But the key thing, if there is no harm, and it may add a benefit, we take that benefit.
Okay. Brilliant. Brilliant. You are done with your questions?
I think I'm done.
Dr. Baryomunsi, you had many.
Yes.
Both medical and political.
Yes. Let me start with what Sarah raised, the issue of the politics of AstraZeneca in Europe.
Yeah, the one of Sarah and Gobi as well.
And Gobi, and then the string of others
that came from the public.
Well, like I said, AstraZeneca, like the other vaccines, went through the required protocols. But like I said, part of the funding came from the British government because AstraZeneca as a company partnered with Oxford University. And we saw a number of countries in Europe saying AstraZeneca is associated with the blood clots and so forth. But even when you examine the data on incidence of blood clots in a population which is not vaccinated in Europe, the incidence was much higher than in the population which had been vaccinated. Incidence means new cases which were, in other words, there was more formation of blood clots in the population not being vaccinated compared to those who were being vaccinated. And as countries withdrew from this immunization, UK continued. I remember, I think the first country to withdraw was Austria, when a 49-year-old nurse died of a blood clot after receiving AstraZeneca. But when they analyzed, she had died of a clot in spite of, not because of vaccination. And UK continued. At that time, they had vaccinated around 11 million people. But the European Medicines Agency, which is the equivalent of NDA here, which authorizes pharmaceuticals and approves drugs and so forth, for it stood its ground, said from an academic and professional and technical standpoint, continue using AstraZeneca. And I think that issue now has been sorted out. So it was more of politics between the companies, but also knowing that the UK had withdrawn from the European Union, the Brexit politics, I think were informing those kind of decisions. But there is no problem with AstraZeneca as such. And I think most of the countries which had withdrawn have gone back to use it. So that answers also the issue of trust of the science. I think it was more of politics than the science. I appreciate the comments on the need to improve communication, and I take them in good faith. And as the new Minister for Communication, I will do everything possible to coordinate and harmonize government communication so that we don't get disjointed voices from all over. With the specific reference, the story which appeared in the Monitor, I think it was quoting the State House monitoring team, health monitoring team, which found out that some people were injecting individuals with something like a vaccine which had not been authorized. And when they checked with the National Medical Stores and Ministry of Health, they said those vials were not the authentic ones. And they quoted Kiswa Health Center, which is a government health center here in Bugorobi, as one of the sites where the vaccination was taking place. I think some people were arrested, the nurses, and as government we have picked interest in this. We are able to investigate, because they are saying it is people from corporate companies who were bringing their staff to be immunized there at a cost. And yet we have been saying vaccines are free, COVID vaccines are free. So why would somebody, after hearing a government message, still take your workers, and these are educated people like Ramadan is saying, and then they inject you at a cost of 200,000, 300,000. So we are going to investigate this, and whoever is behind this, we shall use the strong arm of the law. Because people should not try to profiteer from this crisis by injecting people with fake drugs or water and so forth. So that one, we shall correct it. And to answer a question which came from somebody, the regulatory mechanism, the private sector has approached the government requesting government to allow them to bring in vaccines. But discussions are still ongoing. We have not yet authorized any private company or private sector partner to bring in vaccines. So if anybody is giving out vaccines outside the mechanism of government, then he's doing something irregular. And if we pick that information, we bring those people to book.
For me, on behalf of the ordinary citizens,
yes,
given what we have already seen as ordinary citizens with the way the private medical practitioners are charging people, taking advantage, we think that government should not first allow them.
Yes, we shall go cautiously and a bit slow. But also, let me warn members of the public. There are people who have made it a habit to abuse social media by spreading wrong information. Of course, globally, there are those people who are opposed to vaccination, even for the other diseases. They have their own campaign. Like you saw something being shared on social media that those who have received the vaccine will die within 2 years. that is just fake news. That's just fake news. But also, that one originated from outside, but even Ugandans, some Ugandans have copied this habit. They declare somebody dead, when you might be here talking on this show, somebody is killing you on social media.
This week they killed Museveni, President Museveni. Then they
Please.
also killed General Muhoozi. And they sent him, I think, to Nairobi in the hospital. But they were in functions where someone would easily see.
I think this is a serious disease. We are losing dear ones. I would really implore Ugandans. Some of these behaviors are not African, are not Ugandan. To start pronouncing somebody dead when you yourself know that he is alive. Because his time will come when he will die, but let's stop that habit. And we are going to use, I think I've discussed with our technocrats, it is possible to trace the originators of these messages. And we have already started finding out who are the people originating these messages, and we shall definitely use the law to punish people who are peddling those kind of false news and wrong information. Bile was asked, why do we require you to sign consent forms? Do not fear anything. One, we have assured you that these vaccines have gone through the required protocols, and we are not worried about the safety and the effectiveness of these vaccines. But you see, when vaccines have been produced for the first time, when you start administering them on people, it is like another phase of research. You monitor and follow up and see whether there is something that could have been missed in the clinical trials. So basically, it is purposes of monitoring, even in Morago and these hospitals. When you go there, when you go to Morago and you are admitted, you sign the consent form, whether you are willing to be treated.
It is actually a legal requirement.
It's a legal requirement.
It is a legal requirement.
So I just want to comfort people, don't read too much, because the suspicion could be that maybe these doctors know there is something wrong with the vaccine. That's why they are saying we consent. No, it is just a requirement so that we can do proper monitoring and follow up whoever has been given the vaccine, for purposes of documenting whatever could happen. And as Professor said, since we began giving the vaccines, we have not had any adverse effects from the recipients of these vaccines. What short-term plan do we have for vaccination? And this also rhymes with what somebody asked, whether we shouldn't borrow the example of Kenya. They are buying their vaccines, not relying on donations. We are also following the same path. Yes, of course, when we get the donations, we receive them. But we have also put money as government to buy as many doses of vaccines as possible. The challenge has been that buying vaccines is not as easy as going to Nakasero market and you pick tomatoes and yellow bananas. Because one, there has been disequilibrium between supply and demand. The demand has been huge, but the supply has been small. And luckily enough, many countries and companies are coming up with many vaccines. Now they are becoming available. So there has been rationing of vaccines from the manufacturers and those countries, and also the countries there have been prioritizing their own people, as we earlier on said. So even when we had money, like you had the story of India, where we had reached the agreement with India to get vaccines, to buy vaccines from Serum Institute, but when the price is heightened in India, they changed the course. But now we have put in money, and we are, for instance, put in money for 9 million doses through the COVAX facility, because it's not easy for Uganda to just buy directly, so we're using COVAX, which is a mechanism to procure these vaccines and ensure equity. We have also put an order for 2 million doses through African Union and the Afri-Exim Bank to also get those. So more vaccines are going to come in.
About what duration is this?
Yes, hopefully there are vaccines coming in this July, the first week. The second week, part of it is a donation from China, 300,000 doses. But these ones we are buying, I think August, September, they should be coming. Because our intention is to ban, we have put more money now in the budget of health to get in more doses and vaccinate a big number of Ugandans in order for us to get what we call herd immunity. So we have put money and we are going to bring in
Is herd immunity the same as community? Herd immunity, is it the same as community immunity?
Well, herd immunity means you must get a critical number of Ugandans. We usually estimate it between 60 to 80%, but it depends on the disease.
Of the population or of the vulnerable population?
Of the entire population which is at risk.
Okay.
You must vaccinate up to 80%. So even if you don't, either herd immunity is acquired through either vaccination or just infection. But of course, we don't want to follow the route of infection because people will die. But if you can vaccinate about 80% of the population, then it means you have a critical number of those who have immunity and they can protect the other 20%, even if you don't vaccinate all the 100. The 80% who are vaccinated will disrupt the transmission of the disease and will protect the other ones. Okay. And this we have to gain it through vaccinating Ugandans. So we are committed as a government. We have put resources. We are going to bring in as many doses as possible so that we roll out and mount a huge campaign and response on immunization, and we vaccinate many Ugandans in order to arrest this coronavirus. Okay. Patrick asked, can you use two vaccines? Like, can you get AstraZeneca and then you get the Russian vaccine or Pfizer? There are studies which are being carried out, especially I know in the UK, they are carrying out, like AstraZeneca has partnered with the Gamaleya Research Institute, the one which produced the Sputnik vaccine in Russia, to see whether you can get the AstraZeneca as first dose, then you would put a booster from the Russian one. There are trials being done, even in the US. So as of now, the results are not yet conclusive. But the Professor
AstraZeneca and Pfizer, there's a study that came out.
Yes.
It was good immune response in Spain.
In Spain.
Yeah.
The study has already come out.
Yeah.
Yes.
And what does it say?
It was good immune response. AstraZeneca
so
and
crossing
Pfizer.
was good.
Yes.
Yeah.
It is possible to get one vaccine for first dose, then the second dose, you boost it with another vaccine, and the response is much stronger than if you use it one.
But people need, if that happens, people will need to be sensitized that they should declare that I had already gotten this one.
Oh yes.
Okay.
Yes. So once we change our protocols and bring these vaccines, we shall definitely guide the population accordingly. But for now, we are still giving AstraZeneca dose 1 and dose 2.
Okay.
Now, there was a question from Stephen, why we didn't approve Professor Wanga's medicine in the best malaria treatment and then COVID-19.
Yeah.
First of all, I want to thank and congratulate Professor Wang and other scientists who are trying their level best to come up with these pharmaceutical drugs and medicines. Well, I don't have the details of why NDA didn't support the approval for the malaria drug. I will find out. But for the COVID-19, I'm sure people know that NDA has given a statement that they have approved it, but it is not a cure for COVID-19. Because somebody is saying, can the government buy COVID-19 and give every family? No. NDA has approved it as part of a supportive treatment. Supportive treatment means...
People are stocking it.
People are stocking and hoarding.
Supportive treatment means, like when you have malaria, you can take a Panadol, aspirin. It will relieve the headache and the fever, but it's not a cure for malaria. So even the COVID-19 relieves some of the symptoms. And I think NDA has advised Professor to do clinical trials before you can say with certainty that the COVID-19 cures this or does this or does this. So it's like a preliminary approval, but I think more work has to be done. I think they have also advised him to change the name from COVID-19 something else because it can be misleading. when you read the COVID-19, you can really think the cure for coronavirus. But I thank Professor, and I think more science must come up and come up with all these medicines.
Okay.
As I move towards the winding up,
The next list.
yeah, because these are questions.
Yes.
Mohanji from Sierra Leone was asked about the treatment, the high cost, the astronomical figures from private sector. Government is engaging the private sector to see that there is that collaboration to bring the prices down, and I think that will be achieved. Is the media not misinforming government? Is the government just following the social media and so forth? No, we are in charge. We are in charge. We are going to guide properly people who use social media. We have laws, but we are also going to handle this miscommunication, because I think the WHO director who said we are not only dealing with an epidemic and a pandemic, we are also dealing with an infodemic. It's misinformation.
It is now more dangerous.
Which is dangerous, yes.
Many of
Which
us
can really be worse than the virus.
Yes, it is worse than the virus.
So we have to deal with that
because
infodemic.
The virus, if you have it, they will test and find you positive and start treatment.
Exactly.
This one, when we are depressed, they test everything: malaria negative, typhoid negative, COVID negative, and everything, and yet you're sick.
And this rhymes with what the Ramadan said, that it is us, the educated people, who are believing in these falsehoods, these rumors, misconceptions, myths. Really, let's be guided by science, because people are drinking all sorts of things in the villages, herbs and so forth. So we discourage self-medication. Yes, I know most of the drugs which we use have an origin from plants. That's where they are. But if you just start drinking and eating grass and so forth, those are not regulated. You can't know which dose. When I was still young, they used to give us some herbs for malaria. They would give you a plastic cup, say you drink the whole of it without stopping, and then you put the cup upside down. That was the dose. But really at where we are now, we should not be using that kind of medication, because those herbs, you can't know the dosage, and they can have negative and adverse effects.
For us, they told us, just drink a whole bottle every day 3 times. This bottle of...
So really our advice remains that if you develop symptoms akin to COVID-19 or any other illness, please rush to the nearest health facility, because the health workers are trained. They will help you. First, they will test you and confirm whether you have coronavirus and give you appropriate guidance on how you should really take care of yourself.
Okay.
Finally,
I think as you look for the last one, yes. I got some messages on Twitter.
Yes.
Some 3-4 of them as we wind up, and I'll give each of you the minister and the professor.
What's the ARVs? He doesn't have to travel to a patch. He can just go to a nearest health facility here in Kampala. He will still be served with the ARVs. And the people at the checkpoint should not stop him. Let him go with his medical records. He will pass and reach the hospital and get ARVs, and then he continues.
Okay, but in such a case, Honorable Minister, in such a case, humanly speaking, if he asked for permission to go back, because it's not that he needs only medicine, he also needs social support, wouldn't it be better to be allowed for such a person to go back home?
That's a justification if you want to get a permit to go home.
To go back home. That would be more reasonable.
But should he still need to be in Kampala and he wants
if he doesn't have a transport means, a car?
You never know. He has a car, perhaps. Maybe. He didn't say it. Okay. I'll give the Honorable Minister and Professor Kalebo 1 minute each, and to the non-doctors 1 minute, I mean half a minute each to wind up. Ronald says on Twitter that watching Honorable Baramunsi Chris talking about science makes you believe he worked for World Health Organization and was world class. He is really good on behind the headlines. Now, let Sarah Birete, Gobi, and Charles answer questions and leave the show to the scientists. But maybe Sarah and Gobi. Ronald, me, I am a pilot. Now, even if the doctors are on the plane, I cannot leave them halfway the flight. I must pilot them. And then someone called, I think, Danny. Danny says, we have been schooled by the scientists, and us, the witch doctors, who keep guessing and predicting phenomena, have gone mute. And then Eriasa says, this is to Professor Kalevu. Charles, do you remember that at some point His Excellency the President said we were on course to make the first country, to be the first country to produce a COVID vaccine? Now, Professor Kalevu is being less optimistic about the vaccine coming out anytime, something like that. Why should the politicians overstate our prospects? I think Eriasa, Professor Kalevu has said there is a lot of work being done. He knows that there is something in the offing, but what he was careful about is not to give a time frame, which is, I think, okay, because you can never know when they break the news. And then someone says, someone here had made a comment and said, why are the witch doctors now quiet? Are they in Kamoli that the witch doctors are hiding from, they can't provide solutions to COVID? I think that's all. Let me now ask Gobi, make final remarks in 30 seconds, way forward, especially some message of hope, if possible.
Message of hope. I don't know, but the government need also to look at, to prepare us for two related crises. You know, I anticipate a baby boom, which will reflect what couples have enjoyed spending time together and what they have been up to, and perhaps also a spectacular increase in divorces for those who have not enjoyed a lot the time of...
Before you finish, can I shock you that as a matter of fact,
you are shocking me.
As a matter of fact, many people who have been undergoing COVID treatment and those who are depressed are actually reporting low levels of family activities because COVID actually affects them. It's one of those things I was even saying, why doesn't Ministry of Health actually adopt the shock therapy of communication that you men take so seriously because COVID will affect you?
Yeah. So I know we are in these lockdowns, and I don't think they are going to end now. We are, as we come out of one, then you put us into another one. Which kind of support are we giving to the younger people who are out there to ensure that we do not lose a lot of them in a pregnancy, then in divorces or fights, as we send them the 100,000 and so on. Thank you.
Sarah, please. Thank you. Professor, that thank you of Gobi was not a very genuine one.
That was a complicated note. But really, my message to fellow citizens is twofold. One, let's take personal responsibility about our health. The major role to break the chain for COVID infections lies with us as individuals. Yes, government has a duty to treat, sensitize, procure vaccines, but we need to protect ourselves. The first wave did not shock us enough. The second wave has shocked the hell out of everybody. We are all affected. Everybody has a relative or friend or an old classmate who has fallen victim. The public figures we saw that have since departed. So let's take responsibility for our lives. The second aspect is the children we are keeping at home who are traumatized. The school breaks. They are losing concentration on online classes, those who have them. The others have no luxury to access online classes. And the vulnerable families that are battling with no food, no basics, no rent, that will soon be homeless, and maybe to our political leader, the Honorable Minister. The 100,000 for vulnerable homes, yes, but what can it do? Beyond food. The last lockdown, the president would talk about tenants and say nobody should evict. Would talk about water and electricity bills. Would talk about these basic services. But this time around, there is silence on those aspects for the vulnerable people. Do we expect to see people pushed on the streets in lockdown? Can a family pay rent and get food on 100,000? What are the mitigation factors to make sure that as we fight this pandemic and break the chain, people are able to keep homes and keep a shelter over their heads? And maybe then the last message for government. I know there are challenges, global politics, bilateral, whatever, but in order for us as a country to avoid a third wave, we must do the best we can in the second wave through testing, treatment, and vaccination, plus saving of livelihood. I thank you very much.
Thank you very much, Sarah. Professor?
I think colleagues have said a lot of what I would have mentioned. We are in the situation where there are lots of unknowns, but we need to work together, government, the scientists, and the public, because now South Africa is in the third wave. They tried their best. They did the first wave, the second wave. Now they are locking down. Third wave, yeah. So there's no guarantee that if we don't implement the SOPs, when the vaccines become available, make sure that we get vaccinated, there's no guarantee we won't go into a third and a fourth wave, because this virus is complicated. Who knew we'll have the Delta? The Delta comes now, transmitting even more than Alpha, more than the Wuhan. Now we have Delta Plus. So we just need to work together to make sure that we really fight this pandemic, keeping the SOPs, and as the government, working with the government to see that we get the vaccines. The vaccines do work. Countries that are vaccinated now, it was mentioned here, they have removed their masks. For us, we're putting on the masks. But also, what do we do to counter the WhatsApp, the false messages? I think we need to work together, government, scientists, to provide the right messages. But people always, the wrong messages are so exciting to people and very easily to move around. But as Dr. Govi said, I get amazed and surprised by some of the educated people bringing to you. You see this coin on somebody's arm who was vaccinated. Yeah? The coin is stuck there. And then see what? A magnet. These vaccines have, and that goes around and people believe. I've tried my level best to educate, including educate my fellow educated ones, but I think we need to do both. We need to work together. There's no guarantee we won't have a third wave, we won't have a fourth wave. Let's take this very seriously. Thank you.
Thank you so much. Finally, Honorable Minister.
Yes, thank you very much. Let me quickly respond. There was a question, somebody said, have you read the book Power, Politics and Population Control? And seen how COVID was created. one, there are theories. There are those who propagate what they call the lab leak theory, that the coronavirus could have come either deliberately or as an accident from a laboratory. Then the other one, which is much more plausible, and also deriving from the other types of coronaviruses, is that it could be a zoonotic virus which passes on from an animal to a human being. And we know the SARS-CoV-1, which was the 2002, came from bats to human beings. Then the one which caused the Middle East respiratory syndrome 2012-2013, especially in Asia, Middle East, came from camels to human beings. Now, this one, the suspicion is that it could have crossed also from an animal, and the suspect is an animal called the pangolin. Maybe from a pangolin, the bats, then a human being. Because the scientists have looked at the virus in some of these animals, like the pangolin, and they have found about 96% genetic concordance between the pangolin and this coronavirus. And that's what most scientists believe could have been the origin. Because, you know, it was first identified from the one food market where they sell meat and other animal species. So that's the most plausible explanation of how it could have come. But a lot of work is being done. So we don't believe that it was manufactured and somebody sent it to finish off the population, because the caller was insinuating that could have been a population control, maybe strategy by some people. Now, my concluding remark is that one, I convey my condolences to the many families that have lost their dear ones. I have lost very many people in my district and constituency. Every day is burial, and want to convey our condolences. Number two, we have a crisis in our hands of coronavirus, COVID-19. But we want to comfort the viewers and listeners that we shall get the top of this situation, because the virus, its behavior is known, the science of it is known, how you can avoid it is known. We just need to be serious as Ugandans. We would want to thank the health workers and all the frontline workers like Professor here, who spend sleepless nights, day and night, doing work to make sure that we remain alive. And as government tries to bring in as much vaccine as possible to vaccinate all of us, our message remains that let us religiously adhere and observe the basic measures which we have all been hearing. Putting on a mask when in public and putting it on correctly. You see people putting it as a necklace and so forth. Because putting on a mask can mean between life and death. Can mean you remaining alive or being buried. Washing hands using water and soap, or use a sanitizer if you have access to it. And avoiding touching your eyes, your nose, your mouth with hands which have not been cleaned or sanitized. These are basic things, but they mean a lot in terms of protecting us. And also physical or social distancing. First of all, avoiding communal gatherings. I received a phone call from a gentleman called Katerega from Kayabwe near Ikweta. He said, I always watch you on television educating us, but here people have refused to take heed to the president's message. Funerals have hundreds of people. People are having gatherings, the bars are open day and night. And my message has been, you don't have to wait for police or military officers to chase you, because they may not reach every corner. But be a police person, a policeman or woman of yourself. Because you sneaking into the bar, congregating with others, might mean you are just digging your grave using that kind of behavior. So let's all be responsible. If we can all adhere and follow these measures, we shall be able to disrupt. People are asking, are you going to extend the lockdown after 42 days? That decision will depend on how we behave.
Yes.
If we follow these measures and the infection rates come down, then there will be no reason for government not to open. But should infections continue rising, we may extend and extend and extend. So let us all be responsible. let everybody do whatever is possible within his or her means so that together we can fight this pandemic. Issues raised by Sarah, issues of rent and the effects of COVID, we are discussing them within the government, and we are going to mount a robust communication strategy. We shall be informing the public on our feelings and the measures we are also proposing. But I can also say, like the president was clearly communicating last time, landlords should be lenient. You should not evict your tenant. You should be lenient to the tenants because they are not earning. That's all. Like there is a politician who said in Uganda, let us all support each other. Landlords be tolerant to tenants as we all fight this pandemic. The assurance I want to give is that we are mobilizing resources as a government. We shall support the scientists. We are going to bring in vaccines and vaccinate Ugandans. But in the meantime, let us all follow and observe these measures, and together we shall be able to overcome this challenge of COVID-19.
Thank you so much.
Thank you very much.
Thank you so much, Honorable Minister. Before I wind up, Danny Nyeka, I want to thank you. On Twitter, he says, the politics and science of COVID has been a very interesting, exciting topic, which has distinguished medics like Professor Pontiano Kalevo and Dr. Chris Baromuzi, and distinguished individuals like Sarah Birete, Ramadan Gobi, Margaret Muhanga, and moderated by the best talk show host, Charlse Ondongtho. So, Danny, thank you so much for watching. But I need to wind up. Except to wind up, I just need to recap everything that has been said, that do your part. It's that basic. The trouble is here, the pandemic is here with us. We shall, as journalists, as media, we shall put government on the mark to ensure that they do their part. How does government do its part? Ensure that the country has vaccine, ensure that there is enforcement of the SOPs, ensure that there is treatment which is accessible. But most especially, let's do our part. Let's not, as individuals, facilitate COVID to spread. Let us not facilitate COVID to kill us. I will tell you, so many deaths, we have all lost people, but what pains me most, the death of professionals. Yesterday we lost, Uganda, I'm told we have only about 13, 14 neurosurgeons, and we lost one yesterday. So painful. Someone from our church in Tinda there, I think Dr. I forget his name, but we lost him, and such a pain. And then we lost young doctors, Dr. Ian just last week, and then an internal auditor, a very close friend of mine at Water, Charles. These are professionals who have been highly trained, and yet young people that are being lost. COVID is here. Let's follow the SOPs. To the friends who are on social media, please share positive messages as well. Don't depress the rest. Don't depress the world. We are already depressed enough. Let's share information that we can verify. The trick about doing away with social media and fake news is this. Simple. If you cannot verify it as authentic, don't press the button to forward. Don't forward and start saying, I also got it, let me share. Let me also leave this here. I also don't know whether it is correct. If you don't know the validity, the authenticity, if you cannot verify, don't send to the next person. That's how we shall fight fake news, and that is how we shall fight misinformation. Otherwise, thank you so much. Thanks a lot, Professor Kalevo. Thanks a lot for sacrificing your time. You should be somewhere reading, doing research. But thanks a lot for accepting to come here. Thanks a lot, my minister. And today we called you as a doctor. and you have not disappointed us to educate the public. We really appreciate. We don't take it for granted. We know that you are very busy, especially starting now, new government, but that you accepted to come and share information and knowledge with us. We really appreciate. Indefatigable Sarah and Ramadan here, always ensuring that they sacrifice your time. Many people are hiding because, you know, COVID is lurking around chairs, on tables, on surfaces, but that you find time to, you know, risk and sacrifice and come and share knowledge with the Ugandans, our viewers. We really appreciate as UBC, as Behind the Headlines. From the team here, Margaret, Ivan, and all the rest of the team, my producers, Morris, Ronald, Fred, Ivan, and the rest of the team, I want to thank you all very much. Until next week, God bless you all. God bless Uganda. Let's fight COVID together. Let's keep to the SOPs. Let's do exercises and eat well. Let's avoid eating junk at this time and oily foods. Let's ensure that we eat organic and do a lot of exercises so that we build our immunity and wait for COVID. If it attacks, unfortunately, we should fight it back. Bye-bye. Good night. God bless you all.